Good morning. My name is Hannah Welch, and today I'm going to talk a little about the legalization of marijuana in the United States and kind of that policy on that and where I stand. So, according to the CDC, it is currently the most used federally legal drug in the United States and has obtained almost 48.2 million users since 2019. Two of the most common uses of marijuana are medical or recreational. Though it has been around for some time, the CDC tells us that it only began to get popular as far as legalization in the last 20 years. So as a reference, this is the amount of states that have legalized it in their purposes. So since April 24th of this year, it is legal for medical use in 38 states, 3 territories, and the District of Columbia. And since June 1st of this year, it is legal for recreational use or non-medical use in 23 states, 2 territories, and the District of Columbia. There are also 9 states which allow low THC, high CBD for medical reasons only, according to the National Conference of State Legislatures. And though pain management is one of the most commonly reported reasons of medical marijuana in the U.S., the CDC tells us that there's little evidence that shows marijuana helps to treat acute or chronic pain. There has also been some research to say that marijuana legalization for medical purposes would help reduce the opioid epidemic. But based on the CDC's findings, the legalization of marijuana does not decrease the opioid overdose or usage. Marijuana use with or without opioids has shown an increase in risk of opioid misuse. This is just one of the ways research has shown that marijuana's good does not necessarily outweigh its bad. I would be more likely to agree with the legalization of medical marijuana if the CDC's findings had a direct correlation with treatment of pain, although I do not support the use of recreational legalization for many reasons. But if it isn't doing any good for medical purposes, then there's a link between usage of marijuana and opioids, then what good could possibly come out of recreational use? So that's kind of my take on that. But, yeah. Thank you for your time.